Let me go ahead and move to the computer. All right, guys. Yes, the session is going to be recorded to be referred back to. I just started the recording now. Welcome, everybody. Welcome to pretty much it's our first actual Lucente webinar for the public, for customers like you guys who purchased the product within the last week or so. There were just quickly a couple things that I wanted to bring to light to everybody's attention. Number one is you guys are going to be getting your kits and you're going to be getting your creams. And it's terribly unprofessional of me to not have a box here. And I don't know. I know I have one somewhere. So we have our kit that's going to have your 2 mesos and then your take-home cream, which is a 1-month supply. And then we have obviously those additional individually packaged creams. So I just wanted to make you aware on the kit, when you get it and you open it up, you may find a little bit of the cream around the rim of it. And it's very simple, very simply the following. I asked my partners at CMed, the manufacturers, I asked them to put more cream in the bottle than what was coming them than what we normally do in other areas of the world. There's a reason for that. I also have your vials with 2.4 mLs as well, a little extra on top because I want there to be an excess amount. So in my greediness of wanting more cream for my customers, what happens is with the moving around, you might get a little bit of a flirt out of it. So the individually packaged ones, you shouldn't find that. You might find that in the kit, which you would open anyways. And if you do, just a simple wipe off. We're talking, I've added 25% more cream to that container to ensure that this take-home cream lasts as long as possible for your customers without having to have them come back too early to have to get another cream. So that was one of the things I wanted to say. I think actually was really all I needed to. Oh, yes. And you can ask the questions. We'll take a few questions after, but it is late for Dr. Firas over here. So I'm not going to try and keep him much beyond his presentation, except to maybe answer a few questions. This will be recorded. I will send the recording to all of you who've been on here. We appreciate the you guys being the first to purchase this in the US, and we know that you've done it because you trusted us, and that's why we're bringing you the best, who is Dr. Firas. So without further ado, Dr. Firas, everybody, Dr. Firas, and you can go into the presentation. I'm going to pass over the hosting duties right now. Let me just go ahead and get you here, and let me pass you over. Okay, doctor. You should be the host now.
Okay, so good afternoon, everyone. First of all, I'd like to thank Dave for his invitation and for making this possible. Dave, I know you put a lot of effort into it, and there's been a lot of communication back and forth. So thank you very much for believing in me and having this. I would also like to thank Carlo, who is joining us for, again, giving me this opportunity and supporting me for CMed. It's a brilliant product. So really congratulations for all of you. You've been handpicked and selected by Dave as one of the first to try the Lucente. So I've been using Lucente for a while now and hugely impressed by it. So for those of you who don't know me, my name is Firas Al-Niaimi. I'm a dermatologist. I'm a professor in dermatology. I'm a physician. I actually treat patients and see patients myself. So I don't tend to delegate. I do a lot of the treatments myself. And living in London in the UK, I see all skin types, from skin type 1 to 6, with different problems, including a lot of challenging pigmentation, melasma, post-inflammatory hyperpigmentation, sunspots, you name it. So I've been using many different treatments. I have a lot of lasers as well. But Lucente has become one of my favorite treatments that I use. And pretty much every day I'll be using Lucente. And hopefully at the end of this talk, you're going to find out why I'm so passionate about this product. And I also want you to be very passionate about this product too. So I'm going to share my screen. I hope you can all see it. Can you see that, Dave?
Yep, I can see your screen. And I believe everybody here can see. Yep, everybody can see the screen. Perfect. If anybody can, yeah, everybody can see it. I can see everybody can see it.
Everyone can see that. Okay. So what I'm going to be doing, we're going to give a presentation. I'm going to try and give as many tips as I can, share my experience and also the protocol on how to get the most out of Lucente. And then as Dave said at the end afterwards, we'll definitely have some time to get some questions and answers. But if you just do me a favor and pay attention, because you'll find that most of the questions probably that you have in mind are going to be answering them anyway through the presentation. So the products of Lucente you can get in the US through Bioskin Aesthetics, which Dave is the founder there. So this is how it comes. If you are lucky enough now to have the Lucente, this is how it looks. And the first thing that I noticed about Lucente when I first saw it is how beautifully packaged this product is. And I genuinely believe that, and I'm serious about saying this, is because I've used many different mesotherapy products. I've been using many different lightening agents and many creams. I've been in this field for many years. But look at the elegance of the packaging. So it's beautifully packaged. In that package, in that box, you'll see the 2 vials of the products, which we were going to be discussing how to use that with microneedling. And then you have this Lucente home cream. So that is the box. This is how it looks like. And then, of course, you have a separate box where the home cream can be used afterwards. So why is Lucente very important? Well, the simple answer is pigmentation is very challenging. Pigmentation is very difficult to treat. Okay, and because of that, we need suitable treatments. And anyone who's dealt with pigmentation will realize that, you know, it's one of those conditions that will humble us. Sometimes it might be pretty straightforward and you think this is going to be easy to treat, but it's either resistant to treatment or it comes back or it simply does not respond. So we've all been humbled. But what is really important is patient selection. And I think that is the key thing. Selecting the right patient for the right treatment. So if you look at these images of different pigmentation, first of all, as a dermatologist, hyperpigmentation is not a diagnosis that we accept. It's a description. Hyperpigmentation is a descriptive term of excess pigmentation, because that is what it is. Hyper is mean excess or a lot. Pigmentation is discoloration. We need to have specific diagnosis. So here you have different diagnoses. On the top right, that's a birthmark called a cafe au lait macule. Now you need a laser treatment for that. On the top left side, you can see all these lentigos or sunspots and sun damage. Brilliant for Lucente. If you want to combine that with lasers, like I will do, you can combine that. If you look at the top, bottom left, again, that is a deep birthmark. That is something called the nevus of Ota. Very difficult to treat. Again, you need a laser treatment for that. But if you look at the bottom right, that is melasma, which is very common. And all of us will see melasma. And this melasma can be combined with sunspots. It can be with post-inflammatory hyperpigmentation. But this is where Lucente will be excellent for. So I think it's important also that you make the right diagnosis and not just treat any hyperpigmentation because it may not respond, and then please do not blame it on the product. It's patient selection is important too, but pigmentation is a challenge. Now, I am known, and I've been also in the US several times giving lectures on the use of lasers, but as I mentioned, lasers can only be used rightly in a number of conditions, particularly these birthmarks. And why is that? So, well, to make it very simple, the hyperpigmentation or the pigmentation that is presenting can be one of 2 things. It's either solid, stable pigment. Okay, so that is pigment that is not really changing. If you look at a birthmark, it's the same as 3 months ago. And if they're going out in a sunny place, it's not going to change. Okay, so that is what we will call solid, stable pigments, like a simple lentigo, a cafe au lait macule, a nevus of Ota, which are mostly birthmarks. So that is solid, stable pigment. Now that is different from the unstable dynamic pigments, which is on the right-hand side. Melasma, post-inflammatory hyperpigmentation, sun damage with the lentigos and freckles. So what do I mean by that? What I mean is that the unstable dynamic pigmentation is the type of pigmentation where the melanocyte, the pigment cell, is very active and it's producing a lot of pigment. Now that activation can be partly because of the ultraviolet light and sun exposure. partly from oxidative stress. So the melanocyte, the cell, is under a lot of stress. And that's why, remember this oxidative stress, that's why it's important that we also use antioxidants. And this is also one of the great advantages of Lucente, because Lucente, in addition to some brilliant ingredients that will break down pigments, also has antioxidants which will control the melanocyte and make sure that the melanocyte is not under stress. Now, there is no laser, no technology that can suppress the melanocyte in terms of producing melanin. This is why we will always need a specific product to be applied to the skin, enable us to stabilize the melanocyte. So just remember that there are two types of pigments. There is the solid stable pigment, and then there is the dynamic ongoing pigment where the melanocyte is awake, the melanocyte is dynamic, and it's producing pigments. And it's this particular type of ongoing dynamic pigmentation that the Lucente is brilliant for, because it has all the ingredients to stabilize, break down the pigments, and reduce the oxidative stress on the melanocyte, which is, to be honest, most of what we will see. I don't know how many of you will see nevus of Otto or a café au lait macule. Well, they come to me because I am known to treat them, but all of us, 9 out of 10 patients who will come to see us with pigmentation, we're going to have melasma, post-inflammatory hyperpigmentation, sunspots, freckling, and what we will call sun damage or photo damage. Right, so before we talk about the product itself, before we talk about the Lucente products and how to use it, let's just refresh your memory about hyperpigmentation for those of you, and those of you perhaps didn't get the chance to dive into the pigmentation process. This is just an illustration of the epidermis, which is the uppermost layer of the skin. So what you see, all these cells, the white cells with the blue dots in the middle, these are the skin cells, which we call the keratinocytes. And this large red cell with all these tentacles, this is the melanocyte. So the melanocyte is a key important cell that resides in the upper layer of the skin, which is the epidermis. And what the melanocyte does, it produces pigments, it produces melanin. And then through these dendritic processes, these tentacles, it spreads and it gives the melanin to the nearby skin cells. So the skin actually gets the pigments from the factory, which is the melanocytes, and the melanocyte, once it produces all these pigments, it will then distribute it to all these skin cells. So why is the melanocyte active? Why will it get active? Well, obviously the commonest cause, which all of you know, which all of us know, is sun exposure, because ultraviolet light, so when the skin is exposed to the sun, the ultraviolet light, then it starts switching on a process, okay, that we have certain genes, it will start switching on a process that will then start stimulating the melanocyte and making the melanin. And this is why we always say that for successful treatments, in addition to the Lucente and other treatments that we are going to do, sun protection is also one of the key things that is important in preventing getting further pigmentation, because that sunlight is going to start triggering a process that will stimulate the melanocytes in producing pigments. Okay, right, now, so this might seem a bit too intimidating for most of us, even for myself when I look at it. I mean, I can't memorize the entire step, but it's important to just put it here because it's important to show you why Lucente is a unique product compared to any of the other products that are available in the market. Right, to get melanin, so this is what happens in the melanocytes. So we have the melanocytes, and we often simplistically just say, well, the melanocyte is producing melanin. Now, that is true, but how is that melanin ultimately made? Well, that's made by certain amino acids. Okay, so in particular, this important one most of you have heard of, which is the tyrosine, the L-tyrosine. So we have this amino acids that through certain processes, certain enzymes that will convert this amino acid through different steps ultimately into melanin. So if you can see, You have L-tyrosine, and then you have the TYR, which is a tyrosine enzyme. So this enzyme is going to then convert this L-tyrosine and make it into L-dopa, and then you have another tyrosinase, and then you get into L-dopaquinone, and that's how subsequently through this complex process you end up getting the eumelanin, the melanin. So there are two types of melanin. The vast majority of the melanin that we have when we talk about hyperpigmentation, we talk about the eumelanin, that is the brown melanin. But if you're of Scottish ancestry, so here in the UK, we have the very light skin types, the skin types 1, where they have this yellow, orange, almost red type of pigment, and that is the pheomelanin. But coming back to the importance of this diagram, why is it important? It is important because Lucente is the only product that has different ingredients targeting different steps of this melanin production. So I'm going to give you one example, and probably is an example that many are familiar with, hydroquinone. Okay, so hydroquinone is one thing that many use, many physicians and many nurse prescribers all around the world use. It's a very old-fashioned, simple bleaching agent. It has melanocyte toxicity, so over time it causes many problems to the melanocyte. But what it does, it just blocks the first step, which is the tyrosinase. So blocking that conversion of the amino acid L-tyrosine to L-dopa, that's all. But what Lucente has, it has different ingredients that target different pathways. Therefore, it's much more predictable, much more powerful, much more effective. But more importantly, it has no melanocyte toxicity. Okay, so it's key, it's important to just appreciate the fact that you get this conversion of the amino acids to ultimately melanin through multiple enzymes. And you have this all here on the left-hand side, and you're going to get the recording of this, and you'll be able to dive in deeper into that. So I mentioned a couple of times an enzyme. What is an enzyme? An enzyme essentially is a protein that catalyzes or enhances a chemical reaction. So in this case, it's the conversion or the change from one amino acid to another product. In order for that chemical reaction to take place, we need an enzyme, and that's what enzymes do. And what enzymes do, if you try and think about a lock and a key to enter a place, to open that door, you have a lock, and then you need to get the key to get into the lock, and then you'll be able to open the door. That's what the enzymes will do when you have an enzyme that's sitting into the active substrate, where then the enzyme is going to be active and change the chemical reaction. So you have a competitive inhibition. So that is the key getting into the lock. So that's where the inhibitor, so the one of the ingredients in Lucente will sit in that place so that the enzyme will not be able to then catalyze this. So what do I mean? You have the amino acid tyrosine. The tyrosinase, the enzyme that's going to convert this amino acid into the next step, needs to sit on a specific place on this amino acid. But the inhibitor, which is one of the ingredients in Lucente, is going to actually sit on that place instead of the enzyme tyrosinase, and therefore the enzyme is not going to be able to catalyze this chemical reaction. So this is what we will call a competitive enzyme inhibitor. So it sits exactly in that part of the lock. Just remember a key and a lock, whereas a non-competitive where it sits on a different site. So this might again just be a bit too much of biochemistry for some of you, but the importance of this is there are powerful ingredients in Lucente that will stop and inhibit the subsequent chemical reactions from these amino acids ultimately getting into melanin. And this is how we can block melanin. So the ultimate result is not getting melanin. And this is important because no chemical peel can do this. Okay, no pill can do this. No expensive laser can do this. The only thing that can do this is these competitive ingredients that are found in Lucente. So what are these ingredients? So if you look at, again, at the first step, which is melanogenic process. So we produce melanin. One of the key products is tranexamic acid, and probably many of you have heard of tranexamic acid. In fact, there are a number of products available in Europe and the USA which will contain tranexamic acid. But the problem with that is they only contain tranexamic acid, and that's it. A basic product. Okay, so a vial just for tranexamic acid, and that's all. Whereas you will see here in Lucente, we have, in addition to tranexamic acid, many other powerful ingredients in terms of targeting pigmentation. So tranexamic acid is one of these key tyrosinase inhibitors. So it inhibits, where you see the TYR on the right-hand side in that flow chart, where you see the TYR, that is the enzyme that is going to then convert the previous step to the next step. That's where tranexamic acid is going to sit and inhibit it. So you can see that it's a powerful inhibitor of a very early step and a very early stage of this melanin production. So that is tranexamic acid. But there is also arbutin, which is another powerful competitive inhibitor of tyrosinase. And again, some of you might be familiar, there are some commercial creams, topical creams available that contain arbutin. So we have, so far, tranexamic acid, arbutin, both of them powerful enzymes that block this tyrosinase, and therefore we stop the conversion of the amino acid L-tyrosine from the very start, so starting at the top of the melanin production. And then we have glabridin. So glabridin is a non-competitive enzyme, so it's not sitting at the same site where the tyrosinase enzyme sits, but again, it's a powerful tyrosinase inhibitor. So far you can see that there are a number of ingredients, okay, working on inhibition of tyrosinase. And that is important because they all work synergistically. So they're all doing their bits and they're all working at different sites. And therefore, we have much better stabilization of the melanin process and inhibition of melanin production. And then one of the unique ingredients that is found in Lucente is aminoethylphosphinic acid. So this is what chelates the epichrome. So it reduces its availability in there, so that it becomes less available to subsequently be transformed into the other chemicals. So if you look on the left-hand side, okay, where you have the eumelanogenesis, if you look at the top of that table there, you will see dopachrome. Okay, so then you have dopachrome that then subsequently gets into the eumelanin, whether it's brown on block, and that is what aminoethylphosphinic acid does. It reduces, because it chelates, it reduces the amount of dopachrome that is actively available to then be converted. So you can see that we are not just working on one step, which is the tyrosinase inhibitor, and we are not having just one ingredient that inhibits tyrosinase, but we are also working at different parts of the melanogenesis pathway at different steps, including here chelation of the dopachrome. I am not aware of any other product that really has all these ingredients working at different stages. So far, what we're familiar is, whether it's the hydroquinone, whether it's just an arbutin cream, whether it's just a kojic acid cream, whether it's just a tranexamic acid meso available, they all have a single ingredient, and they're just working on the inhibition of one single enzyme, one single step of that process. But as you can see here, we have multiple ingredients that work at different enzymes at different stages of the melanogenesis, which just makes it much more reliable and much more effective. Right. So why is pigmentation difficult to treat? Well, the honest answer is because we've not been treating it adequately. And what do I mean with that? I'm going to give you some real life examples, okay, including experience from myself being a dermatologist for many, many years. we see pigmentation, we think, okay, let's get a laser and treat a pigmentation. Now, how do lasers work? They will break down melanin. That's how they work. The melanin that we have in the skin, the laser is going to break it down. But let's wait for a second. We can break down existing melanin, but remember what I said. We have two types of pigmentation. We have the solid stable pigmentation, and we have the dynamic, ongoing, unstable pigmentation where the melanocyte is still active. Well, there's no laser that will suppress the melanocyte. None of the lasers do that. There's no laser that's going to inhibit this melanogenesis process. None of the lasers are going to inhibit these enzymes and stop them from working. So this is why the patient might get some brightening, but the pigmentation will going to come back very quickly. Now, okay, another thing, we may do a chemical peel, okay? Some will say, well, I like to do a chemical peel. Fine. Well, a chemical peel is a peel. That's exactly what it does. It's going to peel off the superficial layer of the skin. So you're peeling off these keratinocytes that are pigmented with the melanin. But again, unless you have active ingredients that are going to stabilize the melanocyte and inhibit the melanogenesis, the pigmentation treatment is not going to be adequate. So to successfully treat pigmentation, we need to target the key steps of pigmentation. First of all, we need to stop the factory from producing melanin. That is the key important step when we're dealing with dynamic, unstable, ongoing pigmentation, which is melasma, post-inflammatory hyperpigmentation, sunspots. So we do that by using all these ingredients that I mentioned, such as tranexamic acid, arbutin, to stop the melanin production. That is the key essential step. So that is one. The next thing is the melanin is being transferred. Okay, so it's packaged, the melanin is produced, it's packaged into these tiny little melanosomes structures, and then it's distributed to the keratinocyte. So what we also need to do is we need to inhibit the melanosome transfer. And that's, again, what Lucente does, because it has a number of ingredients that inhibits the transfer of the melanin. The third thing we need to do, those pigments, those skin cells, the keratinocytes that have the pigments, we need to get rid of them. So we need to exfoliate them. Again, you'll see that Lucente has ingredients that will help with this low-level exfoliation. And lastly, what is very important is why is the melanocyte under activity? It's because a lot of time the melanocyte is under stress. Melanocyte is being stressed because of the oxidative stress. So we have oxidative stress from the environment that is going to make the melanocyte more active in terms of producing the melanin. And therefore, in addition to sun protection, which we all know about, we need to also have antioxidants that reduce the oxidative stress, protect the melanocytes, and make sure that the melanocytes is not going to wake up and become active. And again, Lucente has ingredients that are powerful in terms of antioxidants and reducing the oxidative stress. So this is why I said I cannot think of a single treatment kit that contains all these ingredients to block down all the 4 key steps of melanogenesis. So many times colleagues will say, what do you think of this cream? Yes, it inhibits melanin, but it does not disrupt melanosome transfer. It does not cause any exfoliation, and it does not suppress oxidative stress. Some will say, what about vitamin C? Very good antioxidant, but that's about it. It does not inhibit melanin formation, does not disrupt melanosome transfer. And the list goes on, but Lucente is the only product that contains all these ingredients that targets melanin production, melanosome transfer, exfoliation of pigments in keratinocyte, stabilization of the melanocytes, and reducing the oxidative stress. And this is why I love it. And this is why it's a brilliant product. And I'm sure all of you will love it too. So once again, this is just an illustration of the steps of melanogenesis. So you have this melanocyte through all these steps that we talked about is going to produce melanin. These tiny little brown structures, the round brown structures that you see That is the melanin then packed into these melanosomes. Then there is a process of what we call melanosome transfer that transfers all these melanosomes into the nearby keratinocytes. And that's how melanin is then generated, but that's how the skin becomes pigmented, because that melanin is then being distributed to all the skin cells. And this is why I say, to successfully treat melanin, we need to target all these steps. Stop the melanin production, disrupt the melanosome transfer, and get rid of existing pigments, and then make sure that the melanocyte doesn't wake up. And that's why we have these antioxidants. So understanding, or let me say more, appreciating this process will really make it easy to appreciate why these ingredients are there in Lucente, and why Lucente is so important in the treatment of pigmentation. By the way, even if you want to combine that, if you want to, for example, in case you want to combine that with laser or with another treatment, that's fine. We can talk about that during the Q&A if needed, but just as a single standalone treatment, it's brilliant at targeting pigmentation because, as I mentioned, it targets all these different steps of melanogenesis. Right, so let's talk about the practicalities now on the product itself, because now you understand the complexity of melanin production, why it's important to target all the different steps, why it's important to have the right ingredients. So what is it in this Lucente that makes it so unique in terms of the brightening anti-pigment effect? It's suitable for all skin types, So skin type 5, skin type 6, oily skin, dry skin, it's suitable for all of them. I've used it in all different skin types. And once again, as I mentioned, working in London, we have all different skin types, so that's not been a problem. Right. Okay. So the Lucente in the US comes in the 2.4 ml vial and a cream. So it's a two-step treatment. There is a step of treatment that you do in clinic when you see the patient, and that is the delivery of the solution that's in these vials. So what's in that vial is a meso solution, is a cocktail of all these ingredients that you are going to deliver through microneedling. So we do the microneedling, we create these tiny little channels in skin, and we apply the solution immediately afterwards. So that is what you are going to be doing in clinic. So that is the practitioner-led treatment. Then the patient is going to use the cream at home afterwards. So there is an involvement from the patient, and there's a bit that you do. And this is important again because patients like to feel being involved in the treatment. And I tell patients, look, there's a bit that I will do, but there is also a bit that you will do. And you will see why the home care treatment is important too, because of the list of ingredients that it has. So the treatment that you'll do in clinic will going to be the ones in the vial, and then you're going to send the patient home with the cream that the patient's going to use. And there are many, many strengths and advantages to using Lucente. It's, as I mentioned, it's a brilliant product with all the combination, the cocktail of the different formulations. There's no preparation needed, like in many of the other treatments, or including the laser treatments. We often need to pre-treat and so-called prep the skin, which means that many patients are just going to be lost and not come back and not bother. This is just real life. The more you make it complicated, the less likely patients are going to actually have the treatment, whereas that's not the case. So it's simple, straightforward, no impact on daily life. There's no downtime, and it works very well. And as I mentioned, it has the antioxidants, which I'm a big, huge fan of, and it's one of the things that I actually published a lot on vitamin C and antioxidants, because we know that oxidative stress is one of the key drivers for melanocytes to become more active and produce melanin. So we have antioxidants there that will stabilize that. Different ingredients targeting different steps of melanogenesis, blocking melanosome transfer, shedding and exfoliating the existing pigments in the keratinocytes. It's all there, which is great. But most importantly, patients love it. So you can have a brilliant product, but if the patients don't really like it, or the patients are not seeing results, then what's the point? But that's the beauty of Lucente, is that the patients really love it. There are so many testimonies. In fact, I also sent a number of testimonial videos that patients were just so happy to share their experience about. So your patients are going to love it. You are going to love it, and that's what we want. We want patients to like it. Right, so coming back to the key ingredients, so you can see that's the vial of Lucente, where it says brightening solution mesotherapy. So that's what's in that vial is what you're going to apply after the microneedling. One of the key ingredients is tranexamic acid. So we know that tranexamic acid is a powerful inhibitor of this enzyme tyrosinase. So we stop the first step of melanogenesis. And tranexamic acid is something that I'm very familiar with, and this is one of my scientific publications I published on tranexamic acid. I use it a lot. In some of the very severe cases, I use it also orally in addition to the topical formulation. And it works in a number of hyperpigmentation conditions, including melasma. You can see here, melasma is one of the things that I published on. So tranexamic acid has become hugely popular, and there's no dermatology or aesthetic conference that you will go to without hearing about tranexamic acid. So you can be rest assured that you have a brilliant tranexamic acid ingredient in this Lucente, plus many more. But one of the other things that tranexamic acid does, it also blocks what we call keratinocyte-induced plasmin. So when the keratinocytes, which are skin cells, are under stress, they start producing plasmin from plasminogen, which then ultimately leads to something called alpha MSH, which stimulates the melanocytes. So that is something that the keratinocyte is actually doing. So there's a lot of communication between these different skin cells, and tranexamic acid blocks this conversion of plasminogen into plasmin, and therefore you have less of that stimulation of the melanocyte because you produce less alpha MSH. So it's quite a unique molecule, tranexamic acid, with dual effects. It has a tyrosinase inhibition, but also the inhibition of plasmin formation. And then the other products, the other ingredients is the aminoethyl phosphinic acid, which I mentioned is a unique, brilliant product at chelating this dopachrome, which again, just to re-emphasize and reinforce what I mentioned earlier on. So that is a further down step from the tyrosine, where you have the dopachrome. Again, it reduces its amount that is available in terms of being active. Then we have arbutin. And again, arbutin is another tyrosinase inhibitor. So that's another ingredient that's found there. And then look at a whole long list of some botanicals and some extracts and some other ingredients, all blocking tyrosinase. The key ones are the ones that I mentioned, the top three ones: tranexamic acid, aminoethyl phosphinic acid, and arbutin. These three are the key ones, but they're not the only ones. There are many other ingredients. And once again, how do we normally treat pigmentation? Well, we were given just a tranexamic acid, or we were given just an arbutin, or we were giving just a kojic acid, a basic single ingredient formulation. And this is why our patients were not happy and the results were inconsistent. Whereas here, just from the tyrosinase inhibition, you have a long list of ingredients. Now, so coming back to the process, remember, you have a factory that produces pigments, and now we have those ingredients on the left-hand side that stop that. But once the pigment is produced and is packed into this melanosome, it then is going to be transferred. So think about a factory that packages things and then has these vans that will transport the product to the customer. So that is called melanosome transfer. It's also very important when we treat pigmentation, we also target that process. Okay, so it's a very complex process where through these tentacles of the melanocytes, the melanosome is being transferred. So again, Lucente has some ingredients such as elagic acid, sodium phytate, and acetyl tetrapeptide 2. And these ingredients acts on disrupting that flow of transferring the melanosome. So it's, as I mentioned, a multimodal approach targeting pigmentation. And then there's salicylic acid. So salicylic acid, again, is important because that is one of the acids or one of the ingredients that helps in shedding that pigment that we have in the keratinocytes. So remember that low level of exfoliation, we want that to get rid of that pigment that is existent in the keratinocyte and the skin cells, and that's where you have that exfoliative effect from salicylic acid. And lastly, but not the least, is the antioxidants. So these are hugely important. So a number of ingredients, antioxidants that reduce oxidative stress, reduces the stress on the melanocyte for it to then produce melon. And look at the top of the list, glutathione. Now, if you've been dealing with pigmentation, and if you've been dealing with patients from Asia, Asian patients, whether from Southeast Asia, Indian subcontinent, or East Asia with pigmentation, I guarantee that you must have been challenged or asked about glutathione. Glutathione is hugely popular in Asia because it's a powerful antioxidant, And what has the science showed? Well, many studies have shown that essentially the less glutathione you have in the skin, the more active the pigmentation. And the higher the level of glutathione in the skin, the lower the level of pigmentation. And this is why they all use glutathione. So glutathione is usually popular because it's a powerful antioxidant that is inversely related to the amount of melanin. As we supplement the skin with glutathione, the skin is going to be brighter, less brown, and less pigmented because this powerful antioxidant is stabilizing the melanocyte and calming it down and asking it to produce less melanin. So, you know, many patients will say, do you have glutathione? Well, I have glutathione in Lucente. Do you have tranexamic acid? Absolutely, we have tranexamic acid in Lucente. Well, what about arbutin? Yes, we do have arbutin. Well, what about some of the ingredients in a chemical peel? We have salicylic acid in the vial. Oh, I heard about niacinamide, which all it does is a weak melanosome transfer inhibitor. That's what niacinamide does. Niacinamide, by the way, is a very simple old product that's available. It does a number of things, but when it comes to pigmentation, it has melanosome disruption effect, and that's about it. But we have a ellagic acid for that. We have sodium phytate. So you can see, if you understand the different steps of melanogenesis and all these different ingredients, we target all the different steps from melanin production to melanosome transfer disruption to exfoliation, and more importantly, the antioxidant effect. And just remember the glutathione, because I'm pretty certain there will come a moment where one of the patients will ask about it. So we have glutathione in Lucente. Okay, now, so those are all the ingredients that are found in the vial that you're going to do in clinic. But remember, I said it's very important that the patient is sent home with a home cream. And the patient will going to have to use a home cream too. Why? Well, first of all, logic. You're treating, but you also want ongoing effect. You want to amplify that effect. You want to have that longevity in terms of the effect and keep, you know, inhibiting, and so that you get better effect. But also there are different types of ingredients that's found also in the home care, which will complement the treatment that you did. So what's in the home cream? Well, we have the tranexamic acid. Of course, that's brilliant. So the patient is going to continue using that and has the tranexamic acid there. Again, the second important tyrosinase inhibitor, aminoethyl phosphinic acid, and the third important one, which is the arbutin. But it also has another tyrosinase inhibitor. In this case, it's oligopeptide 34, and it has glabridin, and another ingredients, and you can see here at the bottom one, glyceratinic acid. Now, so this glyceratinic acid is found in the home care but not found in the vial solution. And that is important. Why? Because now this is a product that was born in Italy, and this is a very good science from Italy, from Modena, which is a very famous university in Italy. And they did a study and they found that glycyrrhetinic acid is a powerful, again, antioxidant, and it prevents the oxidation of the DNA damage in keratinocytes. So again, it's a powerful ingredient in reducing that DNA damage, particularly in when the skin is exposed to sunlight. And some of the sunblocks that are available also contain glycyrrhetinic acid because of its effect in stabilizing and protecting the DNA. So this is why it's also important that the patient doesn't just rely on what you do in clinic, but continues to use the home cream too. And remember what I mentioned about melanin being transferred into these skin cells, the keratinocytes, and then you have the pigment sitting there. We need to get rid of it, which is why we exfoliate and shed and peel the pigment from these skin cells. Now, in the vial of Lucente, there's only salicylic acid, but look at all the other ingredients that are found in the home cream. So you have, in addition to the salicylic acid, you have citric acid, tartaric acid. Again, both of them help in this low-level exfoliation of the pigment from the skin cells, and the hero retinol, which everyone's going crazy about. Everyone wants retinol. Everyone is asking for retinol, and you have retinol here. So I tell patients, well, look, you don't need to bother by using the retinol at night, because that's the first thing the patient is going to ask. Oh, I'm using my skincare, I'm using my retinol, where does that sit? And I say, well, sit, relax, you don't need to use a retinol because we actually have a retinol ingredient in here. So there are a number of additional ingredients in the home cream that are not in the vial, and this is why it is very important that the patient continues the home cream treatment and doesn't only rely on what you do in the office. And then in terms of the melanosome transfer, again, phytic acid is one of the ones that we add, but there are a number of different ingredients again. So once again, it complements the treatment that you do. And in terms of the antioxidants, it has panthenol, and tocopherol acetate, and hyaluronic acid. And this is why every patient who's used it says it feels really nice. It feels really nice. The skin is not drying, no peeling, no tightening of the skin. Why? Because there's all the good stuff in it, such as panthenol and hyaluronic acid. And this is why the texture is nice. It's hydrating. They don't need to bother a lot with moisturizer. I tell them, well, if the skin is still fine and moist because you have hyaluronic acid, you don't need to. Some patients insist on still using a moisturizer. I say, well, wait an hour, use a moisturizer afterwards. But you'll find that most patients actually don't need to use a moisturizer because there are hydrating effects here with the hyaluronic acid and panthenol. So if you just, I appreciate some of these ingredients might be a bit too scientific and might be just a little bit foreign to many of us. But if you love science, if you love and appreciate science, you will love this product. And there's nothing will stop you from other than just admiring this product and having huge respect for it because of this cocktail of ingredients in this product, that most importantly, patients like it and don't feel that they are having any side effects. I have not had any patients who had any side effect from this cream. And again, pigmentation, as I mentioned, is something that's close to my heart. I do a lot of research and I do a lot of publishing. This is one of my publications on really the top 10 cosmeceuticals for facial hyperpigmentation. I was one of the co-authors here. So you can see all these ingredients, where there is evidence for, okay, because there are lots of things where, there are claims, but there is not necessarily evidence for. And you can see that many of these ingredients are already found in Lucente, arbutin, retinol, resorcinol. There's a resorcinol derivative, licorice root extract. Many of these are found in Lucente. So the protocol. How to use it. You get someone with pigmentation. Now, remember, first of all, the diagnosis needs to be made. If there's any doubt about the diagnosis or concern, then Obviously, that needs to be checked by a physician, a dermatologist, just in case there is something that is malignant and not suitable for treatment. So once you have assessed the patients and you deem them suitable for Lucente, so typically the dynamic unstable pigmentation, melasma, post-inflammatory hyperpigmentation, sunspots and sun damage. So there is the treatment that you're going to do in clinic. So that is with the Lucente. So you have in the vial 2.4 ml. So typically what we say is for a full face, 2 ml will be sufficient. So you'll use the vial. Use the vial, use the whole vial, one vial for treatment for the whole face. And then the patient's sent home with the cream. Then they use that twice a day, morning and evening, for 2 weeks. And they come back, then you do the treatment again, and then you send them home. And then at that stage, they can continue to use it just once a day in the evening. However, what I would say is use your judgment. Use your judgment. Sometimes for the very stubborn, deep pigments, I ask them to continue using it twice a day. In fact, they will say, can I continue using it twice a day? So this is the protocol. They come to you, you do the microneedling. So the microneedling depth is important. You don't need to go deep. 0.5 millimeters is sufficient. You certainly don't want to see bleeding. You don't want to see pinpoint bleeding. Why? Well, it's logic, because the pinpoint bleeding is going to then inhibit the delivery of all the ingredients through the channels. So the idea is that this microneedling is just creating these channels for us, so that then the solution, which has very, very low viscosity, so it's very watery, very low viscosity, which is important in terms of the delivery mechanics through these channels. So then the Lucente solution is going to then get through these channels and get into the skin, and this is how we get the brightening effect. So 0.5 millimeter, but use your judgment in case you have very thick skin. Imagine you have a man with very thick skin in the cheek and very deep pigments. You can go up to 1 millimeter, provided that you don't see the bleeding. But to keep it simple, you can start with a 0.5 millimeter and apply the solution. You can start needling on dry skin, and then as you needle, you slowly drizzle the solution on top of the skins, and then you continue needling. I personally like to just have a little bit of that gliding with the needling, so I just apply a very little bit of the Lucente, massage that on the skin, so I just have a little bit of a moist base, and then I start needling, and then I continue needling and slowly deliver the Lucente. Patient finishes. If they want to use a cleanser, they can use a gentle cleanser. It's not necessary, but I know that many patients, they just want to use a cleanser. So this is why I recommend that if that is the case, use a gentle cleanser. Then they're sent home using the home cream for the first 2 weeks. For the first 2 weeks, we recommend the home cream to be twice a day. So that's morning and evening. I know that there was one patient who, wants to know everything about the ingredients and said, well, there's retinol in there. Can I still use it twice a day in the morning? Yes, that's fine. There's a lot of hyaluronic acid in there. There are a lot of, there's panthenol. There's a lot of antioxidant in there. It's not drying. It's not peeling. So there's no problem there. Okay. So just in case you wanted to ask that question. So the first 2 weeks, they can use it twice a day. Then they come back. You do the treatment again, and by then you can just send them home and use the cream once a day. But as I mentioned, use your judgment. Sometimes for the very stubborn pigment, ask them to continue using it twice a day. I use this microneedling device from Campomats. It's an Italian one, brilliant one. I love it. I have used many different types of microneedling. It's very lightweight, so it's very easy to hold, very lightweight, very predictable, very precise. Literally very, very precise. I can tell that. Very simple and easy. And also the needles are nice and thin, and they are arranged in a way that gives good distribution. So I use that one. Right. And then this is to send the patient home afterwards, because the patient is going to require quite a lot of the home cream use, especially for the very deep, stubborn pigment. This is what Dave initially mentioned. In this box, they are standing more vertical. So then you can sell this to the patient, and then the patient can continue using this at home. Right. And so now, why microneedling? Some might say, well, can I not just, slowly inject that? So, well, in some countries, they like to inject. But actually, if you think about it, in my opinion, is better to apply this after microneedling. Why? Because from microneedling alone, there is enough evidence, and these are some of the articles that I'm just sharing. There's enough scientific data and evidence to show that actually that helps on its own. The microneedling on its own helps in breaking down the pigments and giving some brightening in the skin. So we have the synergism, we have the benefits of a dual action. We have the microneedling effects on the pigments, and we have the Lucente effect. But what's also very important is when you do microneedling, and let's say, imagine you put it on a 0.5 millimeter, we know exactly where that Lucente is gone. So it's very predictable, it's very precise, it's homogeneous. And because of the needling, so you're getting even distribution of the Lucente at a predictable depth. If you're going to inject, if someone is injecting, well, first of all, we don't know how deep. Sometimes there might be a bit more superficial. Sometimes you're a little bit deep. You may inject a bit more in one area, maybe inject a little bit less in another area. So there is a bit of inconsistency at the depth of injection, the amount, therefore it's not homogeneous. And remember, you're not getting the benefits of the needling itself. Many patients, most of my patients with pigmentation, I tell them I'll do a little bit of microneedling, I'll put it on, they say, oh yeah, that's great. I used to have microneedling, really loved it, really liked it. So patients are already familiar with the treatment of microneedling, so why not use the benefit of both? And sometimes they just get also a little bit of a rejuvenative effect from the microneedling. I appreciate, typically we use a deeper level of the needling. I do know that, but sometimes even with a 0.75, 1 millimeter on the thick skin, the skin just looks a bit healthier and feels a bit healthier afterwards. So just wanted to share with you, a number of articles that we now know here that microneedling is a good adjuvant treatment for pigmentation. And it will be great to combine then the Lucente with that. So this is again microneedling with topical tranexamic acid or tranexamic acid alone. Definitely the evidence has shown that if you microneedle and deliver tranexamic acid, it works much better than putting the tranexamic acid as a serum or a cream alone. So really, there's very little role for just a tranexamic acid cream or a serum. And from my experience, they have a very limited effect, but if you combine that with microneedling, you get much better results. And of course, as you saw, tranexamic acid is one of the key ingredients of Lucente. Right, so I'm almost there. I appreciate, I really, thank you for your patience. So why Lucente? Well, because Lucente can inhibit synthesis. It's called luminescence in Europe. It's Lucente in the US. It blocks all the 4 key steps, blocks the melanin synthesis, reduces the oxidative stress, melanosome transfer, and it has an exfoliative effect. So these are some of the before and afters, but I'm sure you will get some amazing before and afters. You will send them with Dave, and Dave will share them with us. If you do colorimetry, where you actually measure and visualize the amount of melanin, you can see that decreases too. Even in men, it works well. This is a very stubborn pigmentation that has no chance of clearing with laser. I can tell you that. But with few sessions, you can see the good improvements. Even here in this patient, I appreciate the lighting and the angle is a bit different, but she was so happy, and you can clearly see that the melasma is improved. Again, here in this East Asian patient, and this East Asian patient, again, just brightening effect improvements. This was a very, very challenging case of melasma. Brazilian lady, absolutely loves the Lucente, is a big fan. And yes, there's just still a little bit of melasma, but she's still having ongoing treatment, but it's significantly better. And she's had everything. She had all the chemical peels, all the lasers. She pretty much had everything. So with that, I'd like to thank you all for listening to me. We're going to take some questions. This is my Instagram handle. If you want to follow me, I do post sometimes about the products from CMed and Lucente, and I'm sure we're going to be seeing your brilliant results. So over to you, Dave.
Yeah, so if anybody has any questions, well, for a few minutes, I mean, we're not going to try and keep them for too long, but if anybody has any kind of, question, you can feel free to throw them in the comment section, and I will go ahead and read them back. I mean, and if not, and it was pretty clear, I mean, it was pretty clear to me, then we'll wait. But just to reiterate while this is going on is in regards to like how are you guys going to sell this to your patients? And I think our sales team in general, if you've been in touch with them, they've given you guys a pretty good overview as to, I mean, this was just how we kind of brainstormed, like how would we tell this to our patients? And you want to have them on the program and you want to decide how long are we going to have them on? Are we going to have them on for the minimum time, which, we say is 90 days? You want to have them on for the absolute minimum 90 days for light pigment, I find, some of the people that have been testing it out for only 4 weeks here in the US, because we know we have believers already in Europe. This product's been out for a long time. And, Dr. Firas has been using this product for a long time. So I know the results were there, but we always like when we bring it here, want to have, our own kind, our own people test it out and play with it. And in 4 weeks, I'm seeing enough to where your patient is going to know that they need to continue on their path for another month and another month. You guys also might hit that 90-day crossroad where, you need to keep them on the cream another month. Or, you know what? This pigment, this melasma was deeper than I thought. We got to get another microneedling treatment in there. So what we like to say and what we like to, put as our average point here would be somewhere around the realms of like set up a monthly fee to have them on there, which includes the first 2 microneedling sessions and the 3 months of take-home care. That's 3 months. So whether you want to make it 400 a month, 500 a month, 600 a month, I mean, your cost per month was broken down to you guys in email and the information and the price list that you guys are paying for this. There isn't much management. You have your 2 microneedling sessions and the client goes home with the cream, and their job is to put it on twice a day at least for the first week. I know Dr. Firas likes to do it 2 weeks, and a lot of physicians do it 2 weeks for twice a day, morning and evening. But I mean, the cream should last anywhere between 3 and 4 weeks, especially since I've spruced up those bottles with a little more. I really wanted to get as close to 1 month as possible, just to make it easier. But we've made it very affordable. I mean, for what it's doing, we've made it very affordable. And I mean, after that 30 to 45 day mark, your clients should get a very good idea of where this is headed. So Dr. Kim, hold on. You know what? Am I missing some stuff here? Oh,
Yeah,
yeah.
I see that there are a few questions. You see there are a few questions. I mean, I could probably answer some of them. One of them is, do you microneedle and deliver, or do you put the stuff on first? I mean, look, very simple. The solution needs to get into the skin, so you're going to have to needle and then get that solution in. So it makes sense, of course, that you needle and then get most of the solution in. But if you
like a dry pass, right?
Yeah, if the skin is very dry, then just for the gliding, I just like to put a little base. So it's literally a few drops, just so that you have a little bit of that moist skin. So the gliding of the microneedling is easier. But then I continue to microneedling, and as I continue to microneedle, I deliver more of that solution. And again, use your judgment. If it's very deep, dense pigment, I just take my time. I microneedle for a little longer. Okay, just microneedle a little longer and deliver that slower and slower. Just thinking about there's so much pigment there and it's so dense and deep. I'm just going to take my time. Okay, so that's one.
And then there was what do you recommend immediately post needling? Is the meso left on the skin? I think you addressed that with like a gentle cleanser if they want after.
I think you mentioned that you're going to have a product that you can use after. Well, look, we talked about it last time. You can just use a simple mask if you want, or just a hydrating mask. You don't need to use anything. The patient can just, if you want to use just a light moisturizer or just a cleanser afterwards, that's absolutely fine. I also start using just a little bit of a hydrating, calming mask. Patients seem to like that. They love it. They think it's a great service. You can do that, but in reality, you just need to clean the skin. You can cleanse that just with a gentle cleanser, and the patient can go home and then continue using the cream.
I
Would
guess,
you would you
right,
use would you use a sunblock? Yes. There is a question about a sunblock. Yes, I do. I personally, as a dermatologist, I'm a big advocate of using sun protection alongside any treatment. Okay, so alongside the Lucente, of course, if they are exposed to the strong sunlight during the day, they will need to protect. And there is absolutely no interaction. There is no interaction between using the sunblock and using the Lucente home cream. So yes, of course, it's common sense that they were going to have to use a sunblock.
okay. And then there was, well, so how long would a patient continue to use Lucente cream at home long term, or do you recommend another maintenance treatment for home care? So I guess realistic, but I mean, with you, you've explained this to me before. I mean, you have the patients come back and you survey and you say you need another month or you don't, or right? I
I
mean,
mean, look, I tell them you're going to have to use it as long as the pigment is there. Now, remember, minimum 3 months. Minimum 3 months. You're going to have to. Let's make it simple. You're going to have some kind of guidance to work on. It's going to be 3 months. Okay, you're going to do your bit for a month. So you're going to do your treatments, and then 2 weeks afterwards, you're going to do that again. And then 3 months is a realistic length of time for the products and the ingredients to get into the skin and do their job and give visible results. So I think judging before 3 months is a little bit unfair on the products and unfair on you as a practitioner. I tell them 3 months, but I also have patients who will say, I really love it and I really like it. Can I use it, longer? Well, yeah, they're using it longer. They love it. But again, from the business point of view, we know that pigmentation is challenging. Pigmentation can come back. Patients are not going to lock themselves inside, and they're going to go out and have sun exposure. So why not say, well, look, you're going to have it for 3 months, and then perhaps after that, for 3 months, you can just stick to the sun protection, and then come back after 6 months, and we can do a touch-up treatments. And that doesn't necessarily need to be the 2 treatments, but you can just do 1 session of microneedling with the Lucente as a boost, and then continue with the home cream. So
and further to that, I mean, if you guys notice, the packages actually, Dr. Fierce helped us build these packages for deeper pigment. You would sometimes you would need 2 kits because you would have 4 microneedling sessions, and you would have this client on the cream for 5, 6, 7. I mean, you've had clients on the cream that have been using the cream for 8, 9 months. I mean, you control it, right? And to keep it going. So it really depends. Like he says, the absolute bare minimum was 3 months, and that's why, like, you won't even sell. If you, I just want a kit and see where I am in a month. You don't do it because, I mean, you probably will see something, but that's not how we want to kind of develop the reputation of this product. We know that in 90 days, you'll know if it's light pigment, very light melasma, you should see outstanding results to a point where they take care of themselves. Listen, like you said, we're blocking melanocytes. It shouldn't be something that's reoccurring unless they're really not going to take care of themselves after that fact, But if they make a conscious decision to take care of themselves after that fact, this product will work for long term. And then Roxanne was asking about, by the way, the home cream. It should last anywhere between 3 and 4 weeks. The bottle.
And remember, again, I mean, we talked about this last time, Dave and I. Not every patient will have their face fully covered with the pigmentation. Sometimes patients might just say, well, it's just really the forehead, or in the case of some melasma, it's really just the cheeks. So they may not necessarily use the cream everywhere, and then it will last them maybe a bit longer.
Right.
And that's the other thing. That's the other thing. If you, for example, if you just have very localized pigmentation that you treat, well, I mean, what you could do is you can still use the full vial, but use most of it on where the pigment is, and just little drizzle of the rest,
Right.
The rest. It's not going to do any harm. Remember, this has no melanocyte toxicity. no melanocyte toxicity. This is not a bleach. So you can safely, if it gets into the normal skin, it's entirely safe. So you don't need to worry about that. Then, Dave, there are a few other brief questions.
Yeah.
I think it's important to answer them. Is melanin inhibitor needed before treatment, especially in higher skin types? No, it's not needed. You can get a skin type 6 in, you can treat them immediately. Why? Because it has melanin inhibition already, which is the tranexamic acid, the arbutin. So already there's melanin inhibition. So it is not needed. That's one. Can an LED mask be used afterwards? No, is the answer. We talked about it again once, because the LED can emit some light that may trigger pigmentation. Okay, remember, the LEDs is not used for recovery. We are not doing deep microneedling here and wanting, you know, the skin recovery, but many of these LED lights can also trigger some of the pigmentation. So my answer is not to use LED immediately after the treatment, because you may trigger the pigmentation. And yes, sorry.
Here, I'm gonna choose which one's over here. So during the 90 days, can a patient still come in to receive treatments like hydrofacial or dermaplaning, or would that interfere? I think hydrofacial would definitely interfere. Dermaplane, could you dermaplane before you would do a microneedling treatment with this product?
I think you can downplane first. I mean, I don't do this treatment. I agree with you. Hydrofacial and the other thing, anything that might aggravate the melanocyte. Dermaplaning I don't do, but I think you can do it before and then do Lucente afterwards.
Yeah, because the I'd see no harm with a dermaplane before. I mean, you're in fact you're kind of opening up the face of it. The whole point that you've been stressing over and over is we need to figure out a way to get this product into the skin. So if it's microneedling, it's microchanneling, whatever it is, we need to figure out a way to get this thing in the.
Yeah, I think there's a good question. There's a question from Trinidad. How much do you charge? Well, I'll let you answer that,
Yeah,
Dave.
so I mean, like I said, I'd like to. I mean, if you're doing it the way that the doctor's been preaching, that you need to have these people on this regimen and they're coming in, I'd like to set a monthly fee to be on this program, or if you want to charge for per microneedling session and for the bottle of cream separately, I mean, that's really all up to you. But those lists that we sent you out outline your cost. That's your cost on a monthly basis, or that's your cost for the kit and 2 creams, or that's your cost for the kit and 4 creams. So at the bare minimum, you should be making double your money. But again, this is not like BioRepeal. You're seeing them once every week, 4 weeks in a row. You know what I mean? This is, you're going to see them for a microneedling treatment, send them home with the cream. You see them again later for another microneedling treatment, you can send them home with the cream again. And then they're going to have 1 more month of cream. So really, at the end of the day, look at your cost. At the bare minimum, double it. At the bare minimum, double it. My recommendation is somewhere around triple it, and that's what you should probably be making on your 90-day kit, for example. The longer you have them on it, the more money you're obviously going to charge them, right? Okay, so we've answered that one. Numbing the skin, doctor. What's your vision?
Yeah, it's a good question. Now, I explained to patients that this microneedling is different from the microneedling that they may have had for rejuvenation or acne scars. We're not going down to 1.5, 2 millimeter deep. We're just staying superficial at the 0.5. Most patients are absolutely fine with it. However, there will always be some patients who are very nervous, super sensitive, or if you think the pigment is very deep, you might get down to 1 millimeter. There's absolutely no problem in numbing the skin beforehand. I do it. I don't see any interaction or any interference or any inferior results. In general, you don't have to. If you're sticking to 0.5, most patients are absolutely fine with it. But if you have someone who's super sensitive, or you think you're going to use 1 millimeter depth, then you can just numb beforehand.
Okay, and then she was asking, another question was, when the clients are using the take-home cream twice a day, are they using a specific kind of SPF after, or a different moisturizer when using this cream? I mean, I guess again, we're recommending gentle sort of basics, like nothing that's super chemicalized, or I mean, we don't want to interfere, guys, is what it is. So like whatever is going to cause the least amount of interference with this is I would assume, based on my million conversations with you, what we would recommend. But what are you about the I guess is there like any kind of like a mineral SPF, I guess is fine, or?
Yeah. No, I think, Dave, this is an important question. So in terms of the moisturizer, honestly, because of the panthenol and the hyaluronic acid that's found in the cream, many patients are not, well, nobody has experienced the dryness and the tightening, and many patients may not necessarily need a moisturizer. If they need a moisturizer, usually what I tell them, wait an hour after the application of the cream, and then you can top it up with a serum moisturizer. But you'll find that a moisturizer may not be needed. But a mineral SPF, yes, in high skin types. So skin types 4, 5, and 6 with a lot of strong melasma. Yes, we know that blue light also triggers and maintains the melasma in skin types 4, 5, and 6. And to block that, you need something like zinc oxide, titanium dioxide. You need a mineral SPF. So in those cases, yes, I get them to use something with a tint, but that's for those patients on high skin type, very strong melasma, going out in the sun. But then they can use that then on top of the home cream. So they will use the home cream in the morning. They will wait a bit, and then of course they will going to use the SPF that contains the iron oxide pigments on top.
Okay. So if they use the cream on pigmentation area, can they use moisturizer all over the face for this cream? I mean, I
knew this question is going to be asked. Honestly, and when we were designing the protocol, I said, patients are going to ask, when can I use my moisturizer? What I tell them, this is what I tell them. Use the product first and see if you actually need a moisturizer, because there is a moisturizer in the product, and that is the hyaluronic acid and panthenol. So I tell them this product has a moisturizer, you may not need a moisturizer. But if they insist, like some patients do, if they insist on using a moisturizer, I actually tell them to use a serum moisturizer. So it's not going to be too creamy, and then it's not going to give us other issues. So I ask them to use a serum moisturizer half an hour to an hour afterwards. But I try and educate them that they do not actually need a moisturizer.
You need to do it, right? Okay. And then can BioRepeal be used prior to session? So you and I had this discussion before. So yes,
well, I don't know about the US and your rules and regulations, and how maybe you can give your take on it. What you think.
Well, I mean, I'm just going on what you told me to what some of our testers have told me. So you told me that you have before. It's not something that you always do, but you have before. So a couple of the people that were using it before do use BioRepeal before. And also, I mean, there's people who have used it even before the second session. But again, remember, guys, we're having it done topical application, 5 minutes, nothing major, as your exfoliant almost before you go in and start microneedling. Yes, it can be done. With the first patient that you do this with, and most of you, again, I mean, you guys haven't used this before, so I would recommend, if some of the more advanced practitioners that have been using BioRepeal for a long time, some of the names that I recognize in this group, on their own volition, they'd be able to decide, you know what, let's do a light BioRepeal, let's go in and let's do the microneedling session with Lucente in the same session. And then some people, I would say, you know what, please let's clean it up. Let's just do the Lucente mesotherapy application, and let's leave it at that and see where we are. And the more experienced you become with this product, obviously, the more you're going to know, what limit you can push in regards to combining it maybe with BioRepeal. But
I totally agree, Dave. And once again, just the answer that I gave you earlier when we were talking about it, I think I absolutely love BioRepeal. I think it's a brilliant peel. Okay, it's a brilliant peel, the BioRepeal. But you need to be familiar with the BioRepeal, and you need to also be familiar with the Lucente. This is not going to be the first patient that you're going to treat, you're going to combine. You're going to find that if the problem is pigmentation alone, honestly, the microneedling and the Lucente is going to do a brilliant job. But there are cases that I see where they say, well, look, I have this pigmentation, but can you tighten up my pores a bit? Can you give the skin a little bit of more of a vitality,
right,
a bit of oomph? And that's when I will combine the BioRepeal. So the aim is to combine the BioRepeal beforehand for its rejuvenative effect, the tightening of the pores. Maybe they have a bit of breakouts of acne with some pigmentation as a result of the acne. But if it's just melasma, It's just pigmentation. I like to keep it simple for the patient as well, reduce the cost for them as well, and I'll just do Lucente. But
Right.
if you want to do biorepeal beforehand, you're going to get amazing results. But you can expect a little bit of tightening, a little bit of dryness. I have had a few patients who said it felt a little bit dry and tight for a few days. So you just need to be familiar with the products and choose your patients carefully.
And so that's a good question by Dr. Kimberly Ayala. Would you keep them on a melanocyte inhibitor after they're done with the 90-day protocol?
Well, I mean, again, that's a judgment that you're going to make based on
On where you're at.
the lifestyle, the type of pigmentation. If it was post-inflammatory hyperpigmentation, so they had, for example, a laser burn, or they had a chemical burn, and they had some post-inflammatory hyperpigmentation fully cleared with the Lucente, then they can just use a sunblock afterwards. If it's one of those problems that comes and goes, and they had melasma for many years, and we cleared as much as we can with the Lucente, then yes, you may want to discuss with the patient of using something of some kind of an inhibitor periodically to reduce the flare-up. So it's going to depend on the severity, the type of pigmentation.
Right. And also maybe
by the way,
keep them on the program longer.
but this is why I mentioned bring them back in 6 months and do a touch-up session. This is exactly what I meant. This is why this is not going to be a one treatment and then you will not see the patient. This is going to be a journey. You'll see them for 3 months. They can come back and then just sell them the home cream. They can just use the home cream. By the way, the home cream is a brilliant tyrosinase inhibitor. So if you want them to be on a tyrosinase inhibitor, just sell them the home cream.
Yeah.
I mean, it's called the home cream. It's called the home cream, but it can very well also be said, an anti-pigment cream, and then it can just be sold as an anti-pigment cream on its own, regardless of the microneedling. But yeah, you can either sell them the home cream, but I bring them back in 6 months and I do a touch-up session, and they love it.
And what about any? I mean, we have a lot of these on our form, but I guess if you would say the main important contraindications, I would assume pregnant, breastfeeding, skin cancer, or had skin cancer. I assume in the last year or two, without a doctor's consent, you wouldn't do it. But are there any other important contraindications that you feel?
Well, the other important contraindications are obviously any abrasions in the skin, any active infection. So if there's an active infection on the skin, break in the skin because you're doing microneedling, then we'll say, well, wait until that is cleared. And then, of course, if there is some patients with eczema, now they might just be a bit too sensitive to some of the ingredients and the acids. So anyone who with an allergy to any of the components. So if someone says, I have eczema and I had patch testing and I had some allergies, you might just want to make sure that they're not allergic to any of the ingredients, because there are a number of ingredients, and in case someone is allergic. So an allergy to an ingredient, active infection or breaks in the skin, plus the ones that you already mentioned, pregnancy, breastfeeding, undergoing chemotherapy or cancer treatments.
So, I mean, would the protocol be the exact same if they were treating pigment or melasma somewhere on the body? And yes, it would. I don't see there being a difference based on the area. Maybe you could go a little
for the body,
right?
For the body, definitely biorepeal. Now the biorepeal body, as you know, which is 50% TCA, is brilliant for that. So that is where you can say, well, this is where it gets a little bit different. The protocol is going to be a little bit different. So you're going to do the biorepeal body, brilliant for the pigmentation on the body. You're going to probably go down to 1 millimeter. The skin is probably thicker, depending on where it is, but you may want to just go a little bit deeper than the 0.5 and definitely keep them on twice a day, the home cream.
Right. Okay, good. And then, so what about if a client had Botox or fillers done? I guess
not a problem. Everyone has Botox or fillers. Everyone, literally everyone that I see, and most patients probably are not a problem at all. Well, I mean, not that they had Botox today and come to me. Of course, it's the usual thing that I will say, and it's the same advice that's on the Botox consent form, that for the next week, do not have any treatment. That's fine. but having had a Botox, let's say a month ago, there's absolutely no contraindication of having Lucente. And if they have Lucente today, they can have Botox in a week. That, to me, it's not a problem.
Okay. And as soon as the client finishes the program, can they start coming in for other facials or chemical peels? I mean, you know, again, just based on my experience in the US and the products that are available, the products that are available in the US, Dr. Firas, as you know, they're not as advanced as they are in Europe. In regards to some of the other chemical peels that are offered out there, it really depends on what you'd be using on them. As we know, BioRepeal, it's a topically applied product. It's super, super safe. And again, it's the not damaging those outer layers, right? So I don't see any reason why you wouldn't be able to do a BioRefill. I assume you agree with me on that. But what about other facials? If, like, after they're
Well,
done the program, I guess it's fine, right? Or
yeah, I mean, if it's a very basic, superficial base facial, then that's fine. But I try and always tell them, look, try not to disrupt what I'm doing too much, because then otherwise, you know, if something happens, then I don't know, is it what they had or is it the treatment? So I tell them no, but a basic facial will be fine. A bit of Botox and filler is not a problem. If halfway through their home cream treatment they want to have a peel, let them have a BioRepeal. So they were going to have the BioRepeal, at least a peel that I know would also work in pigmentation. So
and safe, right? So it's about also about the safety and stuff. So I guess in your
absolutely.
opinion, once they can complete a series of treatments, you don't need to keep them on the home cream. But again, he said it before, so it depends. The home cream, some of the customers that I've seen in Europe, patients on home cream months. It's not necessarily because they used the 2 microneedling treatments and they sent them home with 2 months that they what we gave you guys as a price list was a base start based on we had to come up with some sort of format for you guys. And I know that any less than 90 days, I don't want to develop a bad reputation about this. If somebody uses it for a month, I don't need them saying it doesn't work. So we know that the absolute minimum in our mind to really see success is 90 days. We set that bar. Would you need extra cream? Could the clients be on extra? Could they be on it for a while? They could. Could they have to come back to you and purchase the cream separately from you? You know, yes, I would hope that they would. And if you feel that they need to be on it, if they feel that it's working for them, you can keep them. You can keep them on the cream.
Yeah, and again, look, I'm going to discuss this with the scientist in Italy, and I hope Carlo's still there. Because look, they're saying, can we then keep them on a melanin suppressant? But that's exactly what the home cream
Home
is
cream
also
is
suppressing melanin. So I think, look, guys, the confusion is because it's called home cream, doesn't necessarily always mean that this has to only be used after the microneedling. No, I have few patients who say, I love it so much. Can I just use this instead of my Arbutin, kojic acid, the expensive SkinCeuticals, tranexamic acid? Because none of them worked. This was the only product that I like and it works. And the answer is yes. I do have few patients who just get the cream from me because, you know, they want that as a maintenance. So
right.
afterwards, if you want them on a melanin suppressant, if that's what you deem suitable, then just put them on the home cream.
Right.
A, they like it. B, you know it works, and C, it's business for you because you're selling them the product.
Right. The other question here, like, so after the treatments with Lucente, can we do biorepeal the third or fourth month? Let me actually
Yes.
address that, right, because I had this conversation with Carlo. I said, hey, you know, there's retinol in this home cream, but the percentage of retinol is very, very low, right? So you're not going to experience that. You know, the clients that come in that have been on these crazy retinol, you know, products, of course, it activates the peel immediately, it contributes to frosting, excessive flaking, but the retinol level in our actual take-home care is very low. There are a lot of practitioners that more advanced ones, again, I stress, will sometimes before that second microneedling session do a very light topical application of biorefill. But again, I've seen enough results without it to where when you start, there's no real reason to start that way. Unless I mean, we have customers that have been buying this product for 3 years and they know it the back of their hand. They know the limits and everything. But you yourself will only know how long have you used it, how important, you know, how well versed are you in it with playing around with it, and you'll decide: can I do a light topical biorefill before I do this? Before I do this Lucente treatment, right? And then do they need to cycle off periodically, cycle off of Lucente? I mean, I don't know. I mean, doctor, you told me you've had patients on Lucente for what, 8 months?
Yeah, I mean, look, it depends on the pigments. You treat until the pigment is gone.
Until the pigment's
And then
gone, right?
they will have a period of maybe just using the home cream alone or just using an SPF, and then they can come back and use the treatment again. The beauty, once again, there is no melanocyte toxicity here, meaning you can use it long term. You're not going to destroy the melanocyte. B, there is no bleaching agent. So, all of this confusion, all of these questions, all of these concerns are because everyone was used to hydroquinone. And sorry, I don't mean everyone, but we as a medical, as medical practitioners, we were using hydroquinone. Hydroquinone is melanocyte toxic. Hydroquinone is a bleaching agent, so we can't use it for a very long time because we get into problems. But that is not the case with this product. So as I said, you can use home cream long term. I have a few patients who are using it for a long time with no concerns.
Well, for that, I think we're not going to keep you up too much longer, doctor. We appreciate you. I can't thank you enough for this. You guys will be seeing a lot more of him because we plan on doing this, for all of you, who trust us with your business and giving this an opportunity. I call it the outside the box thinker. Because when we started with BioRefill, most of the time the calls were like, if it's not peeling, it doesn't work. But then you get those calls where like, well, what you're saying is it will bypass the superficial layer and okay, well, you know what? Let me try that. And that's what I call as an outside the box thinker. So mesotherapy, like I've told you, doctor, everybody kind of, there's a lot of people still sleeping on it in America. People don't realize how popular it is in Europe. So it was kind of, really, there was really no peel with TCA in the United States, like ours before we came. So this is new. This is innovative. It works. Dr. Firas has been using it a very long time. So that's why I chose him. I mean, I can't think of a practitioner
Well,
this
thank you.
more than he is.
Well, I've also been using the ingredients individually for a long time. I've been using using glutathione for a few years. I actually source it from South Korea. I've been using tranexamic acid alone as an ingredient for a long time. Before that, I was using Arbutin. So what I was finding is like I was using a bit of this, and then I was trying to do a bit of a peel, and then I will get the retinol. And then the skin is going to be dry. I'll get them the serum of the hyaluronic acid. But what I'm really grateful for is that we now have everything in one kit. So we have the retinol, we have the hyaluronic acid, we have the tranexamic acid, we have a bit of the peeling agent, we have the arbutin, we have the glutathione, and that's why it's brilliant. And every single dermatologist, including US colleagues that I talk to, and I explain the concept and the ingredients, the first thing they'll say is, how can I get hold of Lucente? Because as I said, if you're a dermatologist, if you're a scientist, if you love science, you will love this product.
Well, thank you very much, guys. Thank you, everybody, for attending. Yeah, thank you again. It really was amazing. And we look forward to seeing more and more of you, as much as possible. And exactly, if you guys have any other additional questions after, you can email your rep. We're always in touch with Dr. Firas. I mean, I talk to him daily. So if it's anything that's, that it's too much for us to answer, he's generally the guy we turn to.